Hello, welcome to PhysioLead. Today I'm going to explain active and passive movements of exercise therapy. So before going into the video, we have to know what is a movement. A movement is nothing but a desired action to accomplish or performed for a purpose. That is, it is a desired action which can accomplish, or it is a desired action that is performed for a purpose. So movements. So in this movements we are having types of movements. What are the types of movement? That is active and passive movement. So passive movements, these are the movements that are done by the external force. Active movements are done by the patient's or the person's own muscular effect. So now in this active and passive movements, today in this video we are going to talk about the passive movements. In the upcoming videos we are going to talk about the active movements and other types of movements. So in passive movements, what is the definition? So when muscles are weak or inactive or relatively so, that is when muscles are unable to do some movement, so the movement is performed by the application of external force. This is known as passive movements. When these muscles are unable to produce some movement, an external force acts as a adjuvant. So here the external force acts as an adjuvant and it performs the movement. This type of movements are called passive movements. Another definition for this is movements within the unrestricted range of motion for a segment that is performed entirely by the external force. So the movement within the unrestricted range of motion, so there is no restriction of the motion for a segment. So it might be elbow, shoulder, etc. So this is produced entirely by the external force. There is no patient's own muscular effort. So everything is done externally. So what could be the external force? The external force could be the gravity, machine, on another person, that is a therapist or friend or any caretaker. It might be anyone, any other individual, and other part of the patient. If the patient one side is paralyzed, so he can use another side to do the movement. So this is the definition for the passive movement. So if we go into the classification of the passive movements, it is divided into A and B. In A we get the relaxed passive movement. In this video we are mostly gonna deal with this relaxed passive movements and accessory passive movements and passive manual mobilization techniques. What is this passive manual mobilization techniques? In this we are having mobilization of the joints, manipulation of the joints, and controlled sustained stretching for the tightened structures. What are the tightened structures? Obviously they will be the soft tissues. It might be the muscle, or it might be the tendon, so or it might be even the capsules. So here these three are separate topics which we are going to deal in the upcoming videos. So today I'm going to explain you about the relaxed